You so much again, Leah, for being here today and speaking with us. Quick introduction, Dr. Savochka is a first-year general surgery resident at St. Joseph Medical Center in Tacoma, Washington. She started her undergraduate journey at Washington State University and continued her medical education at the University of Washington. Following this, she went on to pursue a general surgery residency where she is now finishing her first year out of 5. Some of her interests within medicine include global health and mentoring future medical students. Outside of medicine, she enjoys cooking, hiking, traveling, and spending time with her family and friends. Thank you for joining us, and we're so excited to hear from you. Before we get into it, is there anything else you'd like to add to your introduction and share about yourself, something that I might have missed and you want to fill in?
No, I think that's a really good summary.
Perfect. We can go ahead and get into it. I just want to start with a quick general question regarding residency. In your own words, can you briefly explain what it means to be a resident and what does the journey to residency kind of look like?
Yeah, to be a resident, so it's kind of this gray place. I would say you're a doctor, but you're kind of not not a real doctor because you're not independently practicing. So to be a resident, it depends on what level of residency or what year of residency you're at. But essentially, it's just after completing your medical education, medical school, your undergrad, taking your board exams, you are now semi-independently taking care of patients in the career or the specialty that you chose to pursue. Of course, you usually are surrounded by like higher level residents and attendings who are overseeing your work, so you're not really doing anything independently. This looks different depending on what specialty or field you choose. So like I'm in general surgery, so for me that looks like trying to do parts of surgical cases independently, whether that's like very small things like suturing the skin closed or like stapling across the colon. It also means taking care of patients, rounding on them, putting in orders, running things by the attending. And it kind of all contributes to your overall learning so that at the end of the residency program that you're in, you feel confident to go and be independently practicing in that field. There's varying amounts of years that each residency program can be. So surgical residency is one of the longer ones. It's 5 years. Something like internal medicine or family medicine is maybe 3 years. And then anything ranges, from three to five, I would say, on average. And then the path to residency so includes doing your pre-med years. So before you apply to medical school, and that's anywhere from like 4 years to plus, depending on people who are, if they're like non-traditional students, and then doing medical school for 4 years, and then applying into a residency program and hopefully matching.
And I know you said general surgery residency is 5 years, correct?
Mhm.
Is there a specific structure as to like what you do in each of those years for the 5 years?
Yeah, so it's very dependent on programs, I would say. So programs are split up, I would say, into two broad categories, like academic programs and community-based programs. I'm currently at a community-based program, but an academic program, usually they're like associated with like state schools. Usually I would say, because I came from an academic institution for my medical school training, usually there it's like very well delineated what you're doing year 1 through 5. First year you're not really doing a lot of surgeries, you're like spending a lot of time doing floor work. You rotate through each specialty that they have assigned to you, and you're kind of taking care of patients, and then each time you kind of get more and more autonomy and more surgical autonomy. You get to go to the operating room more and more until in the end you're, I would say, doing less of the heavy like patient work and you're doing more of the operating. Um, and then in a community program, which is a program that I'm at, it's a little bit different because I would say I have times where I'm like operating a lot and getting to do a lot in the OR, and then times where I am just completely flooded with floor stuff. And so it's very variable. Like it's hard to say like exactly what we do each year, but it's essentially like your autonomy is just increasing each year, and you're allowed to do more with like less oversight. Your attending is always signing off on things, but they're less, I would say, managing you at this like very microscopic level the further on you get in your training. I hope that answers the question. It's not like very easy to answer unless you experience it.
No, that was perfect. Thank you. What drew you to general surgery as a field, and what kind of cases do you commonly see?
So general surgery, I would say I just always had this idea in my head that I want to go into residency to be a general surgeon. I don't know why. I maybe watched a little bit too much of Grey's Anatomy at one point, but I just thought it was the coolest thing ever. I thought it was a really nice vessel to be able to use, like even internationally. I did some global health work, and I got to see surgeons kind of doing things like that. In more like disadvantaged cities across the world. And so I was like, oh, that would be a cool tool to use. And also, I'm not afraid of blood. I actually think it's really cool. I think, cutting into people is really cool. I don't know why. I just thought that was really fascinating. And so I just continued down that path. I never really thought about not doing it. And then I got into medical school, thinking like I'm going to go into surgery. And I didn't realize like, oh, maybe I should consider other specialties. So I eventually was told like you should highly consider other specialties and don't be so tunnel visioned. And so I did, and I always kept on coming back to surgery. When I did my surgery rotation, I literally thought it was the coolest thing ever. I thought I was on top of the world. I thought it was like the most unique thing you can do, and I just kept on coming back to it. And I was like, I want to do this. I want to do this. And eventually, I applied. I thankfully matched, and now I'm here.
That's amazing. Was there any other specialty that was like kind of top two for you under general surgery?
I would say I thought about doing OB-GYN, but the only reason I think I thought about doing it is because there was a surgical component to it. I also thought about like critical care, doing internal medicine. I think I like the medicine aspect of things, but I also like the fact that they can do procedures. And so I think for me, it just kept on coming back to like, what is the common reason of like why you want to go into a certain field? And it always seemed to be like hands-on things, like doing hands-on, like having hands-on skills. And so I eventually just kind of bit the bullet, and I was like, I'm just going to do this, and hopefully it works out.
I mean, and it sounds like it's worked out great, and that's so exciting that you've had such a good time. Along with that, what is your, I guess, typical day-to-day look like on the job as a general surgery resident?
Yeah. So I'll talk about my last month. My last month was pretty busy. I was on a surgical oncology rotation, which I would say is across the board a pretty busy. You have like a lot of sick patients, sick cancer patients on your service, and so it would be very long hours. So we'd get there probably like anywhere like 6-ish probably, to do pre-rounding. Pre-rounding is essentially you kind of look over all the patients, you look at all their labs or their vital signs, any updates since you left the hospital, the previous evening, how they've been doing, how are their laboratory values look, and then you go and meet with so I had a senior on the service. He was our chief resident. He's a fifth year. So then him and I would go and round on the patients. We would, see all the patients, talk to them, kind of set our plans, like, okay, today we're going to remove your NG tube. Today we're going to advance your diet to a liquid diet, things like that based on how the patient was doing and all of the data that we had collected. And then we would go talk to the attending, and then go around with him. And so like everything would be finalized. We'd put all our orders in, who's getting what, who's getting discharged. And then we would do our notes, and we have to get this done before like 7:30, which is when usually our first case starts. And so then we would do some sort of surgery. So I was on surgical oncology, so we do like some sort of cancer surgery. So removing any type of surgery, removing to any type of cancer, which are usually like pretty long cases. And so then we would do that. Sometimes I would get asked to like leave the operating room and go and check on patients or do things, but I would always end up coming back, and then we kind of round again. There's a lot of rounding. Residency is all about a lot of rounding on patients, and we go round again, check on our patients and see, the things like, let's say we wanted to get a CT scan for someone, we wanted to get an X-ray, we wanted to do something, have those results come back. now is this change our management? Are we doing anything else? So then we, do that, then go back to surgery, try to eat sometime in between that, which I wasn't always very good at. And then we would leave after the day is done, which would be anywhere from like 5 to 8 p.m. It was more of a busier service. Sometimes there would be like a clinic day. So instead of doing surgeries, we would just see clinic patients. So the people you operate on, you have to see them in clinic because you have to take care of them, to the end. Or the people you're about to operate on, you have to see in clinic as well. And so then we would see the clinic patients and kind of do the same thing as we were doing when we were operating. And so in summary, I would say a lot of early days, a lot of late days, a lot of rounding, a lot of chart checking, and then, getting into the OR and getting to do, anything, any part of the case, I'm like always excited to do. And, just like, usually it's like closing skin or like, stapling something, but it's always exciting.
What are some of like the most general or common cases that you've seen, whether it's related to oncology or just surgery in general?
So depending on the service, so we do a lot of like bread and butter general surgery, so like acute care surgery. That would be people that come into the hospital with abdominal pain and they need surgery for it. That would be like appendicitis, cholecystitis, like inflammation of the gallbladder, a bowel obstruction. So like, someone has some sort of something causing their bowels to be twisted or, adhesed and they can't go to the bathroom. We do surgery for that. I would say those are like the most common surgeries. We do a lot of like colon surgeries. So if people have diverticulitis, sometimes it gets really bad and it perforates. So I'll remove a portion of the colon. We, make people ileostomies, colostomies, cutting out cancers. So like on surgical oncology, we did a lot of Whipple procedures, which is essentially when you have a pancreatic cancer and you have to remove it, but it's like a very complicated way of doing it because you have to remove all the surrounding structures and rearrange the anatomy. So we did a lot of that. I would say like that's the most of like the bread and butter cases that I get to see. Of course, in different fields, you'll see different things. Like on trauma, you'll see completely different types of procedures and surgeries. On vascular surgery, you won't be doing anything inside the abdomen. You'll be doing everything on vessels. So that's different, but I haven't done those yet.
And then I guess along the same lines as the past question, I know you talked about your day to day. Is your week, do you go in every single day of the week? How does that look like?
Yeah. So at our program, we do golden weekends. So residency programs, I would say, are structured differently. Some, the way the time off works, some do like 6 days a week, 1 day off every week. And then you get like 4 weeks off a year. And then other programs do like, you do basically, you have 2 weekends off, 2 full weekends off a month, and then you're working everything else. Our program, I would say, is a lot different. On average, I would say I would do like 1 full weekend to like 2 full weekends a month. And what that looks like is you're on call from Friday night to Monday morning. So we cover 2 services when we do that, and that's surgical oncology and colorectal surgery. And so you can have anywhere from like, 15, 20 patients on your list, and you're the one who the nurses are going to call if something is going on with any of them. You might get called at like 2 a.m. and have to go to the hospital, but you round on them. You do kind of everything you've been doing throughout the week, except you're the only one doing it, and then there's one attending who is supervising everything. So I would say is like most of the time what it ends up being, which I prefer that. I prefer having like a really, really busy weekend where you're like, you don't see the light of day. But then you have potentially more weekends off where you're like not doing anything at all.
Got it. I know you touched earlier on your interest in global health. Can you talk a little more about how this passion came to be and kind of anything you've done related to global health in the past?
Yes. So as a kid with my church, we did a lot of like mission trips. So I kind of was exposed early on to being, outside of the United States. And I always loved that. I thought it was so cool being outside of the country and, it always give like a good perspective of like how people live, especially like in very poor areas of the world. And so then going into my pre-med years, I did, um, there was certain organizations that I volunteered with that did like some sort of mission where they would come and like help do like dental work or like some sort of surgery for people like on an elective basis abroad. And so I ended up going to Guatemala, and I did that probably, I think, my beginning years of college, and I loved it. I thought that was so cool. I didn't get to do much, of course, because I couldn't really contribute much with anything. But it was just like a really good eye-opening experience. Like, okay, this is something I do want to do. And so then going on later into in medical school, my medical school had a global health pathway, which meant like you can do certain things to get this certificate that you completed the pathway. And so the things involved doing projects abroad. Unfortunately, I was supposed to do a project abroad that got canceled because of COVID. So I ended up doing an online version of it where I was still like interacting with the people in the country I was supposed to be in. But then fast forward 2 years later, which was last year, I actually ended up going to that country and kind of essentially helping out in terms of like doing seminars and helping the medical students there with like kind of from an educational perspective. So I really like that. And then now in residency, there isn't anything incorporated into our learning that would provide like a global health experience, but I know that's something that they would be open to because other residents have done it. So I may or may not do that in the future, but I know as an attending, I do want to incorporate that somehow.
The global health pathway that you mentioned in your medical school, do you know how common that is throughout medical schools, or is it more niche to the medical school that you attended?
I would say it's probably more common to like bigger programs and bigger academic programs. Usually they have more resources available for things like this. So I went to a pretty big academic institution in Seattle, and they had a lot of different pathways, a lot of different programs, and so that just happened to be one of them. I don't know what it looks like in other institutions, but I think that like usually in bigger institutions they try to incorporate like a diverse variety of programs that students can get involved in.
And how do you think this would look like incorporating into your like career as a physician?
As a physician, I would say I don't think I could do something like on a long-term basis, like just move away somewhere for like 5 years. I don't know. I don't think so, but I don't foresee that. I would love to be connected to a hospital somewhere abroad and even come as like an education, like as a person who can provide education to trainees. I've thought about helping out with like, oh, coming and doing a bunch of surgeries and leaving. There's a lot of discussion about whether or not that's ethical because doing a lot of surgeries and leaving, and then it's like, who's going to take care of these patients if something happens? Like, you operated on this person, but what if they have a complication? Like, who's going to manage that? So I, don't know if depending on like the situation, that would be something that I would be interested in doing, but I would obviously have to see like what the entire care for these patients would look like. I think what I've seen it be useful as is like just providing education for people, because everywhere surgery is done differently. Some of the places where I've been at, most surgeries are done open and not laparoscopically. And our surgeries here, a lot of them are done laparoscopically. So it's kind of like education both ways. They can teach me how they do how they do it their way, and you can teach, like, okay, this is how we do it in the States. And I've just found in any form of education is always like welcomed in places that don't have a lot of resources or access to this information.
That'd be amazing to have in the future, I feel like. And I know you said you're also, along with that, interested in mentoring future medical students. How do you go about that? Like, what does that approach look like? And has there been something that's been particularly outstanding among medical students that you've worked with and talked to that has, like, that makes them stand out?
Yeah, so I have been participating during medical school. We had a lot of different opportunities for mentorship, like mock interviews, one-on-one mentorship, like group mentorship, panels, things like that, that I would try to participate in. And I always felt that was very useful because as a medical student, I didn't know what I was doing. I was like navigating something that it seemed like no one had ever done. And I was trying to invent a way to do it. And I didn't know anything about, the MCAT or like what pre-med extracurriculars are and this and that. And so it was hard, and I had some resources that I was able to use, but I just would appreciate having like some sort of concrete guidance. And so as I always told myself, like when you get into medical school, like you're going to pay it, you're going to pay it forward, and you're going to help people who, like, especially, if you grew up and you never knew anyone who was a doctor outside of your pediatrician, like that's really hard. Like, how do you shadow? How do you get connected? So like a lot of students who get into medical school happen to have, like parents or somebody that is a physician, and like that makes it so much easier when you're ready to like have your foot in the door. But when you don't have those resources, or if you're coming from a background that's like, maybe less privileged than other people, like it's very hard to get started. And so my institution had a lot of opportunities for that. And I, took advantage of all of them and tried to help as much as I could. And then going forward, I mean, I just found out about this. I thought this was very cool. Our program director was like, "Oh, can somebody talk and, do this panel thing?" I was like, "I'd love that. Sounds like something I'd like to do." And then I would say, sorry, what was the other part of the question?
Like, has there been anything that makes the medical students stand out though that you talk to?
I think people who you can see like they're very passionate about this is what makes them stand out. A lot of times, you know, people aren't coming into this with the same energy. Like, you don't know why people are motivated to go into medical school. Maybe some people were like told they have to do this and they like actually don't care about it. Or some people are like, oh, this would be a fun thing to do. And, they don't realize like the dedication and the actual commitment that it's going to take. And I think the people who have like a very big passion for it, but also like an awareness of the difficulty really stand out, because that level of maturity, I would say, is what it takes to survive. I mean, this is not an easy path. I'm like year 10 and I'm not done. And I, sometimes don't see the light at the end of the tunnel, and it's frustrating. And, I question myself, like, did I really do the right thing? Do I need to, I mean, at this point, I have no choice. I have too much debt. But really, you question yourself because you see your friends who are, maybe not doing this, and they're like, looks like they're living their best life, or they're doing these things that you just cannot do right now because you don't have the time, or you don't have the finances, or usually it's time. And so I think talking to people who just like understand that, and that's like not a limiting factor for them, like they're just like have this sober mind regarding medicine, and it's not like this fairy tale of, oh yeah, like I'm gonna be a heart surgeon, and like just because I saw it one time in a movie and it looked cool, like someone who like understands like this is actually what it takes to achieve these goals. And like you can see that they're really motivated because they have been doing X, Y, and Z. It's hard as a pre-med, I would say, like to get involved in research sometimes and get published, or start a project, or do things that make you stand out, because it's like getting so competitive every year, more and more. You don't know how to stand out. Like, what are you supposed to do anymore to stand out? But just seeing people that are just like getting creative and trying, I think has been really refreshing.
No, that's amazing. And before we move on, I just want to say we genuinely really appreciate you for having such a passion for helping future medical students and being here today as part of that, because that's literally the whole reason why we started PhysiLink. And I know a lot of our team had the same issue of not being from families with medical backgrounds or having that to guide them. And that's why this initiative even began. And we appreciate you being here to kind of help us, because I know we're still lost and we felt lost and we probably will be lost in the future. But this is so helpful to have your guidance.
Yeah, you're very welcome. I'm very happy to be here, and it's something about being lost together, I think, is helpful. You're
No,
not
for sure.
lost.
On a different note, do you have any particularly memorable cases, interactions, stuff that you found really interesting that you've seen so far in your general surgery residency?
Um, in my general surgery residency, um, I would say working like just this past month, having been on surgical oncology, which is like a very heavy rotation. I mean, it's very busy, but you're dealing with a lot of very sick patients who are a lot of them probably are going to die at some point, and a lot of them do die while you're on service, and you just kind of have to deal with that. And I think that can be quite challenging to navigate. I did have a patient pass while I was on service, and it was like halfway through my rotation, and it was someone that I had kind of developed a relationship with. They weren't like walking, talking, but they were like coherent enough at times to like have a conversation. And I was taking care of doing dressing changes for this patient, so I was in the room quite a lot, I would say. And the family's always there, and they're talking to you, and you guys are just kind of have this relationship, and you kind of understand like you can't be overly positive or promising, but you also want to match their energy of hope and what they're trying to bring into the room. And but also like you don't want to bring in your experience or like what you probably think is going to happen in this situation. And I think that was very challenging. And then when the patient ended up passing, it was just kind of like we knew it was going to happen at some point because he ended up withdrawing care, but we didn't realize it was going to be so quickly. And so that was like kind of a little bit of an unpleasant moment to be a part of, but it shows you that this is not a part of every physician's life, but a lot of specialties, you're going to deal with this. And you have to know how to, I would say, like, appreciate or respect the moments that you get with these patients, but also don't let it tug on your heart too closely because you still have to be there for your other patients. And I think it takes like a very, very large amount of maturity to get to that point because, I in my before residency or before medicine, I would say like I'm very easily attached to people, and I'm like I would be so sad and like emotional if something remotely close to death would happen. But now being seeing this all the time, you're kind of swinging to the other side of the pendulum. You're like, I feel so apathetic. I feel like I'm dead inside. I feel like I see so many people pass and it just doesn't affect me. And I feel like finding that middle of like, okay, this was a person, they were alive just now, or like I want to appreciate like the learning I got to do with this person and XYZ, but okay, we have to move on. Like this is, and I think that's something that has been difficult to learn and something that I'm trying to like navigate.
Have you, I mean, in the experience that you've had, how do you feel like you do navigate breaking bad news to family if it's a situation like this, or even on your own, just dealing with obviously the difficult aspect of surgery and specific specialties within surgery?
Yeah. I would say I'm right now still very fortunate because I'm such a junior. I oftentimes don't have to be the person to break the bad news. It's usually the attending, but I can like prepare, set the stage. Or I would say, sorry, what was the question again? I spaced out.
Or just how you would navigate or go about breaking the bad news to the family, especially when if it's a situation like you were talking about and people have maybe seen it coming, maybe haven't seen it coming, and they're kind of on edge.
Yeah, I would say breaking bad news, I would, you first always want to come in and you want to like gauge what the patient and their family know about what's going on. Because sometimes you want to come in and be like, just deliver what's going on. And like you realize, oh, they don't even have any concept of like actually what the situation is. And so like coming in and kind of asking like, okay, so what's your understanding of, your loved one's medical condition? Like, what's your understanding of kind of the prognosis? Like, patients have been told so many different things, and I find a lot of what you say to them, they don't retain or they hear in a different way, and it could all be influenced by like emotion and just, level of knowledge of medicine. And we use a lot of fancy words that people don't understand and can be embarrassed of like asking what they mean. And so just understanding what they understand about what's going on. And then, always the way I was taught was like, you don't want to kind of like drag it out. You just want to tell straight on, okay, well, I want to tell you that this, and you say it, you kind of drop this piece of information and then you wait for the reaction. Like most people, when you tell them bad news, you expect them to have a bad reaction, but you want to give the person an opportunity to have whatever reaction they want to have. And then you want to name that, like address it. Like, oh, I can tell I can see you're very sad or you're very angry or you're, and just like you kind of have to become, I would say, like a psychiatrist. You have to really just let them lead, but kind of lead them in a way. It's kind of hard to explain. You just kind of like name what they're going through and kind of let them this, say what they're feeling and this, but then also be able to provide the actual information that they need to hear about, what's going on. And I would say I don't have to do that too often right now, but the more senior you get, the more autonomy you get, and the more you have to deal with this kind of stuff. I would say from my experience, I can see, let's say you're like really busy, you have a lot of patients to see, and, the last thing you have time for is like sitting here and like going over someone's emotions like, oh, how they're feeling about what's going on, and you just like want to deliver this information, be like, okay, like I have to go. But I have seen people just, really take good, excellent care of patients by just like letting them just, work through this and trying to work through that with them with, the bad news. And it's always, I think at the end of the day, even if it takes longer, it's better, I think, for you, it's better for the patient, to get that like closed loop communication of like, this is what's going on. Like, we can revisit it. Like, we can talk about it more, but like, I want you to know, like, you're heard, but like, this is the news. And, I would say it's like it can be very challenging because sometimes, people don't want to hear what you have to say, but you just kind of have to deliver it.
Is this something that you feel like medical school prepares you for well, or do you kind of just learn more with experience?
I would say my medical school had a bunch of workshops on like having difficult conversations, and there's different acronyms that they would use and be like, okay, name the emotion, then this, and then this. And it's like when I'm going to be in the moment, I'm not going to remember like, okay, what's L again? L is, what's N? Okay, oh yeah, name the emotion. Like, I'm not going to remember all these things, but you remember the concept of like, because I remember we would practice with each other because I was in medical school during COVID, and we would do these Zoom interviews, and you have to like tell your peer that someone died or whatever, and your peer has to like have this reaction to it, and then you're like, oh, okay, I see that makes you very sad, and then the person's like, yes, it does, and then you're like, oh, and you have this like scripted dialogue, but it was always kind of funny to do that. But I think you know it's like the little tools that you have for when you are doing this, because in reality, like, this is research based, like, of how to do this stuff. It's the right way to do it. You just kind of find your way of doing it, like when you're talking to patients, because you patients will teach you how you need to talk to them. You will be like, oh, okay, and, you'll catch yourself like, oh, maybe I should not have said it like that. Or you'll just end up like tuning the way your personality, like your patient personality, you'll end up like tuning it based on these interactions that you have, and it becomes easier to have these conversations. But medical school did provide like the launching point, but it's definitely did not like it's not comprehensive.
Got it. I know you also like you're just completing your first year of residency now. Have you looked into or considered any fellowships, and do you have suggestions on how people should be exploring different fellowship opportunities within a specialty?
I get asked this question quite a bit. I would say in general, there's no, there's nothing that I'm like set on. Um, but there's different specialties that I'm interested in. So I'm probably leaning towards doing some sort of fellowship, but I don't know if ultimately that's what I'm going to end up doing. The way that I was taught is like and I was taught this way in medical school as well. It's like always prepare for the most competitive specialty. Like just have like an application ready to go. Do research, do volunteer work, do this, do that. So that if I am like my third year was like, oh my, I actually really want to do this. I love this. You're not like, oh no, I'm like literally unprepared for this. I don't have the qualifications to even be considered for this specialty. So that's what I'm doing. I think that being exposed to a variety of specialties like during your rotations is really helpful. We get a lot of sometimes it can be a little bit biased because, every program, let's say, focuses maybe on certain things. Some programs are like really good with trauma. They have really great trauma exposure. Like some programs have really good this exposure. And so maybe if you're constantly being exposed to these areas, you're like, oh, I want to do this because I love this. But it's like, actually, it's really just like good at that institution. I'll say at our institution, we have really, really good exposure to surgical oncology and colorectal surgery. Our program director is a colorectal surgeon. She lets us do a lot of her cases, like basically all by herself. You get a lot of good robotic exposure. And so I am leaning towards colorectal surgery, but also I'm like, I feel like I've just have so much, so much positive experiences with it, that could make me, a little bit biased towards it. So I'm trying to be like open-minded. I feel like the best thing that I was told to do is like, first of all, figure out what you don't want to do and just like put an X through that. I'm like, okay, I don't think I'm going to be that kind of a surgeon, and I think I'm okay with that. And then like figure out like what you're like, okay, I could potentially do this, I could potentially not. And then like, you just kind of work your way backwards.
What is the most competitive specialty within surgery?
I would say probably it's between plastic surgery, cardiac surgery, like cardiothoracic. Um, I would say those colorectal surgery is pretty competitive. Surgical oncology is pretty competitive. A lot of specialties that have like really good lifestyles and really good reimbursements are really competitive. Hence plastics. And other ones are just like just very challenging to like get through the residency. So it's like going to be competitive because you need to have the cream of the crop, like heart surgery or whatever. Um, I would say those for, I would say ortho, but you can't get to ortho from general surgery. So, but that's like just in terms of residencies, that's competitive. I don't think I could think of anything else right now.
Someone also asked, you're talking about qualifications. She asked, so the qualifications you're mentioning, is that similar to doing extracurriculars like volunteering, et cetera, in undergrad? And how's it different from undergrad? How do you find these opportunities as a resident?
I would say qualifications, um, what I mean by that is, so you have unfortunately more exams that you have to take as a resident. So at least in general surgery, like the exams never stop. I literally thought it stopped in medical school, but we have this exam that we take yearly. It's called AppSite. It's like an in-service exam. So, you want to try really, really hard on that. Like some programs, it's like, oh, just make sure you pass. But we're always told like, no, do your absolute best, get a really good score because that's going to be factored into your fellowship application if you do apply to a fellowship program. Research. So we're told that to do, you want to do like write abstracts, submit videos to conferences. We don't have like built-in research years, so we don't have access to like bench research that like academic programs have access to. But we have people that do like literature reviews and other like smaller scale research. And so we're always told like, make sure you're doing things, a certain amount of things every year that you're getting your name on and your first author, you're augmenting your application. And then I don't know if this is kind of something that goes into your application, but I think it's something that helps, but your case volume. So you have to log your cases that you get. We're fortunate, we get access to a lot of good cases where we get to be surgeon junior. And what that essentially means is in residency, there's, I think, about 850 cases that you have to do like as almost like the whole case to be able to graduate. And fellowship programs have access to that information. And so you don't want to be like barely making it because, the more access you have to cases, the better you are surgically. And surgery is like one of those skills that is developed. It's not like you just get it after doing X, Y amount of cases. You keep on working on it all the time. And when you have a lot of cases, like it just kind of shows maybe your surgical skills, your, dedication. We have like one resident who has just like a large amount of cases, just like an unreal amount, but he's just always hunting them down. And, he's doing a competitive fellowship. And so it's like all of that stuff goes together. I think extracurriculars I think they're helpful, but I think doing like, most residents are not going to have time to go like volunteer at a food bank. And I don't think that's like actually expected. that's something that I, would do as a pre-med or as a medical student where I have like a lot more access to time. But it's like if I have 2 free weekends or 1 free weekend, like, I'm probably not going to be able to do as many things. So I'd say that's like most of it. Doing any other random things, is probably also helpful. Like, participating in opportunities, like doing something like this, or, there's random leadership opportunities that come up. That's probably something else that's helpful. But I think for the most part, it's probably your exams and your publications.
Got it. That's super helpful to know. If anyone else has any questions, please feel free to put them in the chat. We can get those answered as we wrap up. While we wait, is there anything else that you'd like to add, just considering that most of our attendees are pre-med undergrad students? Any advice that you have in general?
Oh, probably so much advice. I think, let me think. Um, I think it's totally dependent, like what stage you're on. But, I think the best thing that I would want to tell myself at this stage is, like you have a long road ahead of you. And that's okay. But like always go back to why you started, because there's going to be so many moments, like I felt like I didn't get burnt out until like after medical school. Like I was able to get through undergrad. It was like fireball. Like I got this. I want to be the best I could be. Like I'm going to be, I'm going to be a physician. I'm going to be this. I'm going to be a surgeon. I got through medical school and I was like, okay, that wore me out, but we're doing this. We're okay. We're still holding on. And then I'm making my way through like my first year residency. I was like, okay, so I know nothing. um, Apparently I have so much to learn. Okay, are we doing the right thing? Like, did we do the right thing? And you have to like come back to like why you started. And I remember I was having like a really rough rotation, and I was just like so busy. I wasn't sleeping, I wasn't eating, I was like going crazy. And we were operating at night one time, which I was like, oh my goodness, I have to like be up again to operate. And it was like I remember I like walked into the OR and I was like, I love this. I was like, I want to be here right now. Like it was like this kind of like serene feeling of, like there's not many people in the hospital right now. There's like only, 3 staff members and they're all in the OR. And we're doing this complicated case. And I'm going to get to do a lot of it because my attending probably feels bad that I have to be here so late. And it was just like, I'm like, I love it. Okay, I want to be here right now. Like it was just like, despite being tired, despite being hungry and X, Y, and Z, I was like really excited to be there. And I feel like coming back to like those little moments of like, oh, wait, I actually love this. Like I actually want to do this. I'm just being like everything is just clouding my mind because of how hungry and tired and this I am. But like if I had all those things, I'd probably come back to the fact that I really want to do this. And I think that's what helps me go forward. And I think if being a pre-med student, you're like a beginning parts of your journey of a very long road. And I think just returning to like to your love, your first love, being like, why am I doing this? Okay, I actually want to do this. I like this. And can be helpful, as cheesy as that sounds.
Thank you. And one more question. Someone asked, what things do you recommend engaging in during medical school to stand out for a surgical residency?
Yeah, so I like literally didn't know that when you get into, I thought you just have to get into medical school, and if you get into good medical school, like every opportunity is open for you. I didn't realize like you have to still yet again continue building your portfolio and like trying to be the best you can be. So in medical school, I would say I like did as much as I could in terms of research. So getting involved like early on, just even, I wasn't necessarily like primary author on things, but I was like helping doing research. That always looks good. Research always looks good at any level. Doing like presentations, posters, things like that. I did my global health experience. That was like a big part of my application because, at the end of your medical school, you kind of have to, I would say, focus on a few things that like really helped you get like, build you and shape you, and like they're gonna be like your argumentative statements is like why a residency program should choose you. And so I did my global health thing. I also did leadership. I was an advocate for getting health insurance at our school because we didn't have that stuff, and like medical care access. So that was a big part of my application. Research. I kind of tried a little bit of like volunteer things. I did mentorship, so I did a lot of like panels, one-on-one mentoring of pre-med students, mock interviews. I had like less opportunities to do like on site volunteering, at like a clinic, but I try to do that every time I had an opportunity. Just like get so little time off that when you have it off, you want to like spend it for yourself. Um, so I would say those are the things that I did during medical school that really helped. You have to write your CV, and so getting it like I would say quality over quantity, but you also want to have like a lot of things to write about. Um, Other people, I'm sure you can be fancier and do way more cool things than I did, but that's kind of the stuff that I focused on.
Perfect. Thank you. And with that, we can go ahead and wrap up. Thank you so much again for being here today and taking the time to share your experiences and all your insights. To everyone who joined us even during busy final season, thank you for being a part of this conversation. If you have any additional questions that we weren't able to get to today, go ahead and you can go to our website and enter questions where I showed you earlier, and we'll get those answered by the end of the month. And then, like I mentioned earlier, a recording this webinar will be on our YouTube, and then it'll also be up on our podcast as well. And feel free to reach out to me, to Sham, to any of the contacts listed on our website if you have further questions, or just if you want to reach out to Leah, we can always connect you as well, and if she can answer any questions that you have. And on that note, thank you so much for attending. Thank you again for being here, and we hope you all have a great evening. Thank you.